What's up, guys? Jeff from Sorta Healthy here. Today we have one goal: pass, no, crush the NSCA CPT exam. Many people struggle with the NSCA tests. They are regarded as some of the toughest in the personal training world. If you make it through everything I'm about to lay out for you though, not only will you not struggle on testing day, I'm confident that you'll easily pass this on your first try. I've helped thousands, probably tens of thousands of trainers to pass different certification exams, and you will be no different. You know those concepts that seem super complicated in the book? I'm going to make them so easy and simple that you'll have no choice but to understand them. So are you ready to absorb all the NSCA material, pass that exam, and get a brand new personal training job? Of course you are. Why else would you be here? Throughout today's video, I'll be referencing a study guide. This guide is free to download at the link located below in the video description. If you'd rather just follow this video along and not download the guide, that works perfectly well too. All I ask in exchange for all this free stuff is that you like this video and subscribe to the channel if you haven't done so already. Both of those things really do help us out over here at Sorta Healthy, and this channel is a free resource for all fitness professionals. Thank you so much for that support, everyone. It really does help. On to the rest of the video. So first things first, I don't work for the NSCA. I do want to make that clear. As I mentioned, I do have a long history of helping trainers pass these exams though. Speaking of which, moving on to steps to pass your NSCA CPT exam. So this book, NSCA's Essentials of Personal Training, the 3rd edition, this is pretty much necessary to pass. Unfortunately, the NSCA courses aren't very good. You do have to rely on book learning quite a bit. I've seen the best deals for this on Amazon actually, and I'll leave a link for it down below. So step 1 is to skim this textbook. Yes, all of it, and in particular chapters 5 through 25. Yeah, I know that's a lot. There is quite a bit of book learning in this course. Now when I say skim the textbook, I do mean it. You don't have to read every single little detail, and while skimming the book, you should be taking light notes along the way. Step 2 is to review this part 1, the video you're watching right now, and the upcoming part 2 video a few times each. The part 2 video should be out in a week or two if you're watching this one right after it's uploaded. Anyways, the part 1 video, the one you're watching right now, covers the most important concepts that are most likely to appear on the final exam. The part 2 video is going to be a bunch of trivia questions and answers where I'll be showing you how to apply the information. Obviously, I'm biased, but if you follow the first 2 steps here, that will be enough for many of you to pass. However, in my opinion, it's usually better to not leave these sorts of things to chance. Luckily, that's where steps 3 and 4 come in. Step 3 is to review on the Fitness Pocket Prep application. Pocket Prep is inexpensive, it's super convenient, and it's just a fantastic way to make sure that you know the material well enough to pass. There's over 1,000 questions on here to help you prepare for the NSCA CPT exam. Pocket Prep is especially great for people who struggle with weirdly worded questions. Link for Pocket Prep down below, and I'll talk more about how to use it in the next video. Step 4 is to consider a practice exam. NSCA has one, and we actually have one as well. Unfortunately, NSCA's is pretty expensive and only so-so. Ours is only going to be $20 upon release. It probably will go up over time. It will have 60 trivia questions where I will personally be walking you through why some answers are correct and others are wrong, and I think that will be really helpful for learning the material. I do want to make it clear that you don't necessarily need to do step 3 and 4 here. They're both inexpensive and will increase your chances of passing, but like I said, many of you will be able to pass just doing step 1 and 2, so do what you feel is best for you. Just remember that retaking these exams is a pain in the butt and it's kind of expensive, so I would recommend taking your studying as seriously as possible. Basically, do everything you can to pass the first time. And on that note, we're going to kick things off with some very basic anatomy. You're likely to get a few questions on very basic anatomy, but nothing too crazy. So anyway, there's 206 bones in the human body. The axial skeleton has 80 bones, and that is the core of the body, and that includes the skull, the ears, the neck, the back, and the ribcage. You also have the appendicular skeleton, and that has 126 bones, and that's the limbs or the appendages. So within your body you have osteoblasts, and these are cells that build or repair bone. The opposite of that is an osteoclast, and those destroy bone. What is the longest bone in the body? That is the femur, or this upper leg bone that you can kind of see in this picture over here. The patella patella or kneecap is a sesamoid bone, which you can see the patella or kneecap right here. So there are four main types of bones: long bones, short bones, flat bones, and irregular bones. Sesamoid bones, like the kneecap we just described, would often be kind of lumped into irregular bones. So the human movement system, or kinetic chain, is made up of the skeletal system, the muscular system, and the nervous system. So the skeletal system provides support and protects organs. It's the body's foundation. It makes blood for the body, and it stores necessary minerals. The muscular system links the nervous and skeletal systems together. It allows for movement, and there are three different types of muscle. You have skeletal muscle. Skeletal muscle is muscle that you have direct control over. So if I'm doing this motion right here, my biceps are doing that motion. My biceps would be skeletal muscle. Smooth muscle would be things internal. For example, you have smooth muscle in your stomach and other organs. And cardiac muscle is in the heart. And again, skeletal muscle is the one that we have direct control over. The other two, not so much. So synovial joints are the most common in the body, and there are a few different types of synovial joints. So your radius and ulna, these two arm bones right here, they form a pivot joint because they kind of pivot around like that. Now your knee, or actually your elbow here too, those are hinge joints because they kind of just hinge forwards and backwards in one direction. Condyloid joints, don't really have to worry too much about those, but you have some in your hand and your fingers, for example. Saddle and plane joints, don't really need to know too much about those. Ball and socket joints, well, you have one right here in your shoulder, also your hip, and they allow for a whole bunch of different ranges of motion. Moving on to the central and peripheral nervous system. The central nervous system consists of the brain and spinal cord. It's responsible for receiving, processing, and responding to sensory information. The peripheral nervous system is made up of nerves that extend from the spine to all other parts of the body, and they send info back to the CNS, or the central nervous system. Some good vocab to go over real quick here. Definitely could pop up on the test. A neuron is a basic unit of the nervous system. A neuron has an axon, a cell body, and dendrites, and it allows you to do everything from breathing to running, pretty much anything. A sarcomere is the basic contractile unit of a muscle fiber, good to know, and a motor unit is made up of a motor neuron and the muscle fibers it innervates. So there's three layers that surround muscle tissue. The epimysium is the outermost layer. Then you have the perimysium, and that's the middle layer, and that's the sheath of connective tissue that surrounds a bundle of muscle fibers. Then you have the innermost layer, the endomysium, and that surrounds individual muscle fibers within skeletal muscles. Also good to know that ligaments, like your ACL for instance, attach bone to bone, and that tendons attach muscle to bone. Probably going to get a question about that. And guys, if you feel like your knowledge base is a little bit lacking when it comes to basic anatomy, which you should know some basic anatomy if you're becoming a personal trainer and if you're going to take this test, I do have 3 videos to help out with that. I have one that goes over basic bone anatomy, one that goes over basic upper body muscle anatomy, and the same thing for lower body muscle anatomy. Consider watching all of these once or twice before taking that big test. For example, if I were to hit you with a question like this, which of the below muscles extend the knee? A. Vastus lateralis, B. Biceps femoris, C. Rectus femoris, or D. A and C? You should be able to quickly figure out that D is the best answer to that question. You should note the quadricep muscles are the ones that extend the knee, so all the vastus muscles and the rectus femoris. You should also know that biceps femoris or femoris is a hamstring muscle, and the hamstrings do knee flexion, not extension. Again, the quads do extension. If any of that was confusing, you really should review these videos a few times and make sure you know the basic muscles and their actions. Don't go too crazy, just focus in on the big muscles and what they do. By the way, if terms like flexion and extension are foreign to you, keep watching because I'm going to teach you all of that stuff soon. But before that, onto some nervous system info. You have the sympathetic nervous system, which is part of the autonomic nervous system, meaning it kind of just kicks on whether we want it to or not. And the sympathetic nervous system is pretty much all about the fight or flight response. You can see this dude over here, he's ready to fight. You might also be ready to run away from something dangerous too. Fight or flight, sympathetic nervous system. The parasympathetic nervous system is also part of the autonomic nervous system, meaning it just kind of kicks on automatically, automatically. And that one's all about resting and digesting. So these two are kind of opposite to one another. Parasympathetic, rest and digest. The somatic nervous system allows you to control your body's movements and receive external stimuli. So unlike the sympathetic and parasympathetic, you do have control over your somatic. So the sliding filament theory is basically just the theory of how muscles contract. So the sliding filament theory is when actin and myosin is larger by the way, slide past each other to generate movement. So myosin, again the larger of the two, and actin sliding past each other and kind of ratcheting to one another. Again, it kind of works like microscopic Velcro, and that is what's happening inside of your muscles to generate movement. This does occur in the sarcomere, which we just said is the basic muscle unit. Speaking of muscle fibers, you have type 1 muscle fibers and type 2 muscle fibers. Type 1 muscle fibers are slow twitch, they are more important for endurance events, they're lighter and less powerful, and they're mostly aerobic, and that means oftentimes fat and just food in general, that's going to be fuel for these muscles. Then you have type 2 muscle fibers, they're fast twitch, they're larger and paler than type 1, they're anaerobic, meaning they don't require oxygen, and they're really used for short explosive periods of physical activity, so sprints, heavy lifts, things like that, and they use carbs, glucose, things like that as fuel. So arteries carry oxygen-rich blood away from the heart to the rest of the body. I repeat, arteries carry oxygen-rich blood away from the heart to the rest of the body. Veins carry deoxygenated blood from the body to the heart, where it goes to the lungs to be reoxygenated. So veins are carrying deoxygenated blood, no oxygen in the veins. Capillaries are the smallest blood vessels and the site of exchange for nutrients, oxygen, CO2, things like that, and they provide nutrients to the tissues. Moving on to some basic heart stuff, you have 4 different heart chambers, 2 on the top, 2 on the bottom. Right atrium and left atrium are on the top, and your right ventricle and left ventricle are on the bottom. The atria are smaller and they kind of serve as blood reservoirs, and the ventricles on the bottom are bigger. So we're going to go into some of this stuff in more detail in a second, but the right atria receives deoxygenated blood from the body. The left ventricle pumps oxygen-rich blood to the body through the aorta, and the SA node, the sinoatrial node, is the pacemaker of the heart. Next up, we're going to talk about blood flow through the heart. I'm going to keep things as simple as possible, and in all likelihood, you'll get 1 or 2 questions about this on the test. Okay, so I've broken down blood flow through the heart into 5 different steps. In step 1, oxygen-poor blood, or blood that doesn't have any oxygen in it, enters the right atrium, and the right atrium is this part of the heart right here. So in step 2, the blood flows through the right ventricle, and the right ventricle is right beneath the right atrium. In step 3, blood is pumped to the lungs from the right ventricle, so the right ventricle is sending blood to the lungs to get reoxygenated. In step 4, the oxygenated blood returns to the heart, and then in step 5, that oxygenated blood goes from the left atrium to the left ventricle. You can see the left atrium, left ventricle over here, and the left ventricle pumps the blood that now has oxygen inside of it to the entire body. Important to know that last bit, the left ventricle is pumping the blood with oxygen inside of it to the entire body. I wouldn't say all of this is worth memorizing. It is worth looking over a few times because, like I said before, you are likely to get a question or 2 about this on that final test. Let's take a quick break from the anatomy talk, at least kind of. Next up, we'll be talking about energy systems, and they are not a top priority, but there's a good chance that you're going to have a few questions about the different energy systems and how the body produces ATP. So ATP is adenosine triphosphate, and ATP molecules provide the body with energy. So if you get asked a question like, what is the main fuel source for the body? The answer is most likely ATP. Now we're going to move on to the chart on the next page. So essentially your body has a few different ways of creating ATP, adenosine triphosphate, and the first of which is the creatine phosphate system, which activates pretty much immediately, so 0 to 10 seconds, and you can see that with this red line right here. So if I'm doing something very short or intense like a 40-yard dash or a heavy set of squats, I'm primarily using this creatine phosphate system. And this is why creatine works as a supplement. It slightly increases your body's creatine stores, which does give you a small edge for short and intense activities. So the first system here is anaerobic, meaning it does not require oxygen to create ATP. The next system is anaerobic glycolysis, and it lasts from about 10 to 60 seconds, and you could see this one just kind of outlined with this yellow line right here. So if you're doing an intense exercise that lasts from 10 to 60 seconds, which a lot of different weight training exercises would fall into that range, you're going to be primarily using this system, anaerobic glycolysis. And because we said anaerobic, this system here here also does not require oxygen to create ATP in the body. And basically this system uses glucose to create ATP, and you can see that right down here where it says glycolytic. Yeah, that means glucose. So glucose for this yellow line right here. And the last system we have here is aerobic glycolysis, and since I said aerobic, not anaerobic, this system does actually require oxygen to create ATP. And this one kicks on a little bit later than the previous ones. Again, this one's usually jumping in around 60 seconds, and these are just estimates here, guys. These ranges can vary a little bit. But yeah, typically aerobic glycolysis is happening around 60 seconds and it's going longer. So yeah, if you're doing longer term exercise, of course, this one is going to take over ATP production compared to these other two. So in this pathway, carbs or fats are burned for energy production, ATP production, and that occurs in the mitochondria or the powerhouse of the cell. The aerobic system that we just described has other components like the Krebs cycle and the electronic transport chain. They can power the body for long periods of time. Think things like endurance events. No time frames for each system. Yeah, so I don't think you need to memorize everything we just went over by any means. That being said, if you get a question about the creatine phosphate system, it's good to know that 0 to 10 seconds, that is the main system that is powering the body. You by no means need to be an expert on all of this stuff, but you will likely get a question or two about it. Next up, we're moving to planes of motion and movement, and absolutely, you will get some questions about planes of motion and movement on the big test. So before going over planes of motion and movement, let's just go over some basic anatomical terms that you should know for the big test. So I'm going to read all of these over with you first, and then I'm going to show you what each one looks like. First up, we have superior or towards the head of the body. Then we have inferior, and that's away from the head or lower. Then we have anterior, and that's the front side of the body. We have posterior, that's the back side of the body. We have medial, and that's towards the midline of the body. We have lateral, and that is away from the midline of the body. We have proximal, and that is nearest to the trunk or the point of origin. And we have distal, and that is farthest from the trunk or the point of origin. All right, so first up we have superior or towards the head of the body. Basically, the higher something is up on your body, the more superior it is. So my neck is superior relative to my torso or my trunk because it is higher up or towards the head of my body. Inferior is the exact opposite, so the lower something is on my body, the more inferior it is. Essentially, my shoulder is inferior relative to my head because, again, it's lower down. Anterior is the front side of my body, so this is the anterior part of my body, my front side. And posterior, of course, is the exact opposite. That is the entire back side of my body. So medial will be towards the midline of the body, so if we pretend like there's a line going down the center of my body like that, the closer anything is to that line, the more medial it is. So my nose is medial relative to my ear because, again, it's closer to that midline of the body. And of course, lateral is the exact opposite. So my elbow is lateral relative to my sternum, for instance. Again, it is further away from the midline of the body. Proximal is nearest to the trunk or the point of origin, kind of similar to medial. So basically, the more proximal something is, the closer it is to the center of my body. So we could say that my shoulder is proximal relative to my elbow because, again, it is closer to the center part of my body. Distal is farthest from the trunk or the point of origin, so it's the exact opposite of proximal like we just said. So my hand is distal relative to my elbow because, again, it's further away from the point of origin or the center of my body. Watch everything I just showed you a few times and make sure you understand all of that. So you definitely need to know there's 3 planes of motion and movement. You have the transverse plane, the frontal plane, and the sagittal plane. The transverse plane divides the body into top and bottom halves, so you can see top half here, bottom half here, and the transverse plane, this window plane looking thing, dividing this guy into top and bottom halves. The frontal plane, as the name would imply, divides the body into front and back halves. So this dude is being cut in half, and again, front half, back half behind this window pane right here. And then the sagittal plane divides the body into right and left halves, which you can see right here. So next up, we're talking about movements that occur in the sagittal plane. And like we just said, the sagittal plane is the one that divides the body into right and left halves. And there's a relatively easy way to remember which movements occur in that sagittal plane. Again, that divides the body into right and left halves. But first, I do need to teach you the movements themselves. So I'm going to read these guys off first, and then I'm going to show you what each one looks like. First up, we have flexion, and that is a decrease in the joint angle. We also have extension, and that is increasing the joint angle. We have dorsiflexion, and that is moving the top of the foot towards the shin, only applies to the ankle. And then we have plantar flexion, and this is moving the sole of the foot down towards the ground, and this only applies to the foot and the ankle. So essentially, as I'm doing this bicep curl type motion, you can see the joint angle here at my elbow is decreasing. So this joint angle is going down as I'm doing that motion. And again, this is elbow flexion, because as I'm doing this motion right here, again, joint angle going down, flexion. So extension would be the exact opposite. As I'm going like this, and this joint angle is increasing, again, that's now extension because this joint angle is getting bigger. So going from this position to this position, extension. So again, anytime you see a joint angle decreasing like this, and it doesn't have to happen at the elbow, any joint in the body, you're dealing with flexion. Anytime the joint angle is increasing, that is extension. Now when it comes to dorsiflexion, essentially pretend that this part of my hand is my heel and these are my toes. I'm trying to keep my heel planted to the ground and then raise my toes up in the air. That is dorsiflexion. And plantar flexion would be the exact opposite. So if I'm just trying to keep my heel here and plant my toes down into the ground, kind of like a calf raise, that is plantar flexion. Probably gonna have to watch this over a few times, but all of these are definitely worth understanding and potentially memorizing. So how do you remember that things like flexion and extension happen in the sagittal plane? I have a trick for you. Going back to this picture and looking at the sagittal plane, again, it cuts this guy into left and right halves. And we can kind of see that this plane, or pane, really a window pane, whatever you want to call it, it comes out in front of him and it goes behind him. If we think about the movements that occur in the sagittal plane, we're thinking about like flexion and extension. They either go up or down, or they go forwards or backwards behind the body. So any exercise that goes up or down, or forwards or backwards behind the body, that is going to happen in the sagittal plane. This picture here also shows that movements in the sagittal plane, typically they have some forwards or backwards stuff going on. So bicep curls, tricep push downs, lunges moving forwards or backwards, squats. Again, these are all things happening in the sagittal plane. So now we're talking about movements in the frontal plane, and like we just said not too long ago, the frontal plane cuts the body into front and back halves. So in the frontal plane you have adduction, and this is movement toward the midline. We'll go over all of these in a second. You have abduction or abduction, and that is movement away from the midline of the body. You also have elevation and depression of the scapula. We don't really need to know these all that well. Something that might be worth looking up on your own time, but not super important for the test. We also have inversion and eversion of the foot happening in this frontal plane. So inversion turns the sole inwards toward the midline of the body. And we can see that here the sole of the foot is going inwards. Eversion is the opposite movement, which turns the sole outwards away from the midline of the body. Inversion, eversion, good to know, but not super important for the test. As far as adduction and abduction go, essentially abduction, so the second one here, abduction, is moving your arm away from the midline. So if I'm kind of lifting my arm up and out to the side like that, kind of like a lateral raise motion, again, that is abduction away from the midline. Now adduction is movement towards the midline. So if there's a midline of my body here, I'm adding my arm back to my body, and that's how you're going to remember this, adding my arm back to my body, that is adduction. You could do the same thing with your leg. If I had my leg out to the side and then I brought it back to my body, that would be adduction, because I'd be adding my leg back to my body. So now we're looking at the frontal plane, and again, it cuts this guy into front and back halves. We can kind of see this thing kind of moving out towards the right and the left of this person's body here. So if we look at that, we can kind of determine that the movements actually follow this plane as well. So this plane is moving to the right and the left, so the movements in the frontal plane are also going to move to the side or the right and left of the body. So whenever you see frontal plane, think about movements moving to the side of the body. And then we can see this here, movements in the frontal plane to the right and left side of the body. Last up, we're talking about the transverse plane, and this cuts the body into top and bottom halves. The transverse plane is probably the weirdest one. Again, the transverse plane cutting the body into top and bottom halves, and everything in the transverse plane has some element of rotation. So movements in the transverse plane. Rotation. When the torso or a limb moves around its vertical axis, we'll go over all of these more very soon. We have pronation, and that's rotating the forearm or foot to a palm side or foot side down position. We have supination, which is rotating the forearm or foot to a palm side or foot side up position. We have horizontal abduction, which is moving the upper arm away from the midline of the body when it is elevated to 90 degrees. We also have horizontal adduction, which is moving the upper arm towards the midline of the body when it's elevated to 90 degrees. All right, so rotation could be a ton of different things. If I'm doing a torso rotation move with like a cable or something like that, that would be an example of rotation. Pronation is this, rotating my hand to a palm side down position. So again, that motion right there is pronation. And then supination is the exact opposite. So if I'm going like this, and the best way to remember supination is cup of soup. I'm rotating my palms up, and I can hold a cup of soup here for supination. Remember that. Horizontal adduction is essentially me kind of moving like this, whether I'm throwing a punch. If I'm doing it on both sides, it's a fly motion. So a fly motion is horizontal adduction. And think about it this way. If it has adduction in there, I'm adding my arm back to the body or bringing my arm towards that midline. Again, the midline dividing my body into kind of halves here. And then horizontal abduction is the exact opposite motion. So I'm bringing my arms away from the midline of the body, and it could be like a reverse fly type motion. And like we see here with movements of the transverse plane, you kind of see this weird rotation-y guy. Yeah, if it has a rotational aspect to it, that movement is taking place in the transverse plane. So it's possible that you'll get a question or two where you'll be shown an exercise and you'll have to identify what movement is taking place. You will also have to identify what plane of motion the movement is occurring in. So if I'm doing some curls, squats, pull-ups, or rows, those are happening in the sagittal plane because, again, they're either going forwards, backwards, or up and down. Frontal plane exercises would be things like a lateral band walk, so that band walk side to side, or a lateral raise. And again, they're going to the right or the left of the body. And then some transverse plane exercise examples. Again, these all have a rotational component to them. So a torso rotation, wood chops, Russian twist. Just look for that rotational component. And finally, in this part 1 video, we are getting to exercise regressions, progressions, and form. You'll definitely be asked a few questions about a client doing an exercise and maybe they're screwing their form up in one way or another, and you are gonna have to correct it. Just like all the other questions on the test, these are multiple choice, so typically you're gonna be able to figure it out, but sometimes NSCA will throw some tricky ones at you. Okay, so let's kick things off with the squat. Your client is about to barbell back squat. You know they hit full ROM, range of motion, when their thighs are parallel with the ground, their trunk begins to flex forwards, or A, their toes dorsiflex upwards, B, their knees press outwards, or C, their heels rise off the floor. And when it comes to the NSCA CPT questions on the big test, there are actually just 3 choices, so A, B, and C. So yeah, this one is actually very similar to something you'll get on the actual test. That being said, many of the upcoming questions are A, B, C, and D, so there's 4 different possibilities. Because I'm trying to teach you guys, honestly, I'm trying to trick you guys a little bit, so oftentimes I do think having 4 answers is better for teaching you the material. Anyways, your client is about to barbell back squat. You know they hit full range of motion when their thighs are parallel with the ground, their trunk begins to flex forwards, or C, their heels rise off of the floor. I'm realizing now it says of the floor, but yeah, if their heels are lifting up as they're squatting down, that means they've hit full range of motion, at least for them. So I'm going to repeat this a 3rd time so you know it. Your client is about to barbell back squat. You know they hit full range of motion when their thighs, so these upper legs right here, are parallel with the ground. Their trunk begins to flex forwards. So let's say this person, their body starts to flex forwards. That means they can't go any deeper, maintaining good form. Or their heels start to rise off of the floor. So if their heels start to lift up as they're squatting down, especially kind of as they're getting towards the bottom, yeah, that means they've hit full range, at least for them personally. Let's look at the lunge. Let's say I have a client lunging, but they're wobbly. How should I regress the exercise? Should I A, allow the client to support themselves against the wall, B, decrease the number of reps that the client is doing, C, have the client do a backflip, or D, make sure you like the video. A lot of good answers here. I don't know, what do you guys think? The correct answer is A, allow the client to support themselves against the wall. If a client is lunging and they're wobbly, B makes some sense as well. A actually solves the problem though, so A is the better answer. Then there's usually going to be one answer that doesn't make a whole lot of sense, the backflip one. I don't know guys. D also makes a lot of sense. Make sure you like the video. Let's say I have a beginner client lunging, they're doing great, and I need to make the exercise harder. How should I progress the exercise? Should I A, have the client do jumping lunges, B, tell the client to perform the movement faster, C, subscribe to the channel, or D, give the client light dumbbells to hold on to while doing the exercise? So if I'm trying to progress an exercise like the lunge or make it harder, jumping lunges would definitely do that, but it wouldn't be the first thing that I would go to, so not necessarily the best answer there. B, tell the client to perform the movement faster. Yeah, that's typically not the best thing to do either. C, subscribe to the channel. Now that's a good one right there. Make sure you subscribe. D, give the client light dumbbells to hold on to while doing the exercise. Yeah, that would be one of the first things that you would try when progressing a movement. Let's say I have a client who's squatting and leaning too far forward. Choose the best cueing advice to give this client. Should I A, tell the client their squat is a mess, B, tell the client to shift the weight back onto the ball of their foot, heels, and hips, C, hand the client light weights for increased stability, or D, stop the squat immediately and don't have the client do them anymore? So the best answer here is B, tell the client to shift the weight back onto the ball of their foot, heels, and hips. So A is very negative and mean sounding, which is always going to be wrong according to these organizations. And yeah, they're pretty much right about that. If a client's form is off or if they're unstable, yeah, you wouldn't really want to add weight to that, so C isn't a good answer. And then D is just a little bit excessive and a little bit negative. They wouldn't necessarily have to stop squatting immediately and not do it anymore. So yeah, B definitely the answer to go with here. So next up, your client is about to barbell bench press. As the personal trainer, you and the spotter, again that's you, where should your hands be as your person is doing this exercise? Should you A, have an alternating grip close to the bar? B, doesn't really matter what your grip is, but you want your hands close to the client's hands? Or C, would you have your hands close to the client's elbows? Take a second to think about it. I feel like the answer here is fairly obvious, but not all organizations actually handle this the exact same way. So for the NSCA, which of these three makes the most sense? So you as a personal trainer should be spotting a barbell bench press with your hands alternating grip, so one hand overhand, the other hand kind of underhand, and you want your hands close to the bar as that bar is moving up and down. So not touching the bar, but close to it. And this is a good position because if your person is actually struggling, you can kind of get in there and help them out. And I really don't think it's worth breaking down B and C here. A is the correct answer. Make sure you know that. Next up, let's talk about agonists and antagonists. An agonist is the prime mover or muscle that does most of the work during a specific exercise. An antagonist is the muscle that opposes the agonist. The easiest example of this is the biceps and triceps. When I'm doing a biceps curl, the biceps are the agonist, meaning they're doing most of the work. The opposing muscle group, the triceps, would be the antagonist. So I'm going to grab this pen here and do some curls, and the main muscle doing most of the work in this motion right here is the biceps, and that would make the biceps the agonist, and the muscle on the opposite side that is opposing, that would be the triceps. So again, agonist for this motion right here, biceps, they're doing most of the work. Antagonist, triceps, they're on the opposite side of the body, which is going to be typical, and they oppose the action that we're doing. So if I'm doing a leg extension, what muscle group is the agonist and what muscle group is the antagonist? So the agonist in a leg extension would be the quadricep muscles. Again, those are the ones that are actually kicking those legs up there. And the antagonist muscles, which are on the opposite side of the leg, those would be the hamstring muscles because they are on the opposite side and they do the opposite motion. Let's look at a slightly more involved example. What is the agonist or prime mover of the exercise being shown, which is a Romanian deadlift or an RDL? And what is the antagonist muscle? So would the agonist be the hamstrings and the antagonist be the glutes, the agonist be gastrocnemius and the antagonist be tibialis anterior, the agonist be the hip flexors and the antagonist be the TFL, or the agonist be the hamstrings and the antagonist be the quads? So remember, the agonist is the muscle that is primarily responsible for doing the movement, and the antagonist is typically going to be on the opposite side of the body, and it's going to perform the opposite action. So in this case, D would be the best answer. In Romanian deadlift, the hamstrings are doing most of the work. In the muscle group that does the opposite action and is on the opposite side of the leg, well, that's the quadriceps. So if you look at A, the agonist here is correct. The hamstrings are doing most of the work, but the glutes would not be an antagonist. They're actually helping the hamstrings do this movement. If we look at B, the gastrocnemius and tibialis anterior, these two muscles are actually antagonist and agonist to one another, but they just don't have all that much to do with a Romanian deadlift. And in this case, answer C is just wrong. I don't think we need to go into more detail on that one. You also have synergists, which assist prime movers or agonists with movements. So when I'm doing a bench press or a push-up, the prime mover there, or the muscle that's responsible for doing most of the work, is pec major. So the pec muscles are doing most of the work for a bench press or a push-up. That being said, deltoids, the triceps, you have a bunch of other muscles that are still helping out there, and those would be considered synergists. Reciprocal inhibition is related to everything we just talked about. The relaxation of muscles on one side of a joint to accommodate the contraction on the other side. We'll just keep going back to the biceps and triceps example because it's easy to show you guys. But again, if I'm doing a bicep curl, the biceps would be the agonist or the prime mover, the muscle doing the majority of the work. And then the muscles on the opposite side, the triceps, would be reciprocally inhibited. They can't really do much because they're being lengthened or stretched as I'm contracting the biceps. You also have autogenic inhibition, and this more has to do with foam rolling and things like that. This is the ability of a muscle to relax when it experiences a stretch or increased tension. So we have Golgi tendon organs and muscle spindles. You're probably going to get a question or two about these guys, and they're both very similar. So for the Golgi tendon organs, they are located at the point where the muscle and tendon meet. The GTO, Golgi tendon organ, is sensitive to change in muscle tension and the speed of tension change. The muscle spindles are sensory organs that lie parallel to muscle fibers. They detect muscle length and speed or rate at which a muscle is stretching. So they both essentially do the same thing. Muscle spindles are actually in the muscle itself and they lie parallel to the muscle fibers. That is key to know because you could get a multiple choice question that kind of gives you the location and then you have to determine which of these two things is the correct answer. So the GTOs are located at the point where the muscle and tendon meet, this musculo-tendinous junction, and again, that is not within the muscle itself. So that is in a separate area outside of the muscle, and again, they both pretty much do the same thing. They detect change in muscle tension and the speed of that tension change. Moving on to muscle contraction types, and this is something we've broken down a bit in this video already, but we're going to expand upon it a little bit more now, and of course we'll get into it more in the part 2 video as well. So first up we have static or isometric contractions. These contractions occur when there is no change in muscle length. So this dude doing a plank right here, he's not moving. He's just hanging out there, holding that move. That makes it an isometric contraction. No change in muscle length. A concentric contraction is when a muscle shortens, and an eccentric contraction is when a muscle lengthens. So let's break down concentric, eccentric, and isometric by looking at the bench press. So we're analyzing the bench press in these 3 different pictures. This is an eccentric path, so as this bar is moving down, pec major, which is the prime mover or the agonist for the bench press, that muscle is lengthening. So that would make this picture, because this bar is going downwards in this picture, that's going to make this part of the lift eccentric because again, pec major, the prime mover or the agonist, is lengthening. Now as the barbell is moving downwards, eventually you're going to hit the bottom and you're either going to be kind of touching your chest or maybe you're just very slightly above your chest. Either way, there is a tiny pause at the bottom of the lift, at least typically there would be. So at that pause, that very short pause at the bottom, that is going to be isometric because the bar at that point in time isn't moving. So the bar is still, again, it's for a very short period of time, but bar isn't moving. Isometric at the bottom. It's also isometric very briefly at the top of the lift because the bar isn't moving. Because nothing is moving, the muscle length is staying the same. So think of like a plank. That's a totally isometric exercise. In most lifts, there might just be a small isometric part. Again, the bottom of the bench press, if you're pausing down there for a second or a fraction of a second, that tiny fraction is going to be isometric because no muscle length changes are taking place. Now what about as you're pushing that barbell back up? Look at this dude. He's kind of struggling to push that barbell back up. So as you're pushing the barbell back up in a bench press, that is a concentric movement because your pec muscles, the prime mover, the agonist in this lift, they're shortening. So your pec muscles are shortening. They're kind of getting closer together. They're getting all bunched up. And because of that, this part is a concentric part of the lift. Muscle lengthening on the way down, eccentric. We have a slight pause at the bottom, so no lengthening or shortening is happening. So that would be isometric at the bottom and at the very top of the bench press for a very short period of time. And then as that bar is getting pushed up from the bottom, that is concentric, again, because the pec muscles are shortening on the way up. Review all that a few times, make sure it makes sense. So periodization is a systematic planning of physical training. The aim is to reach the best possible performance for a specific time frame or event. You achieve this by changing up exercise variables when appropriate. And some exercise variables that exist are sets, reps, time under tension. Of course, there are other things too. So for breaking down a periodized plan, an entire periodized plan is a macrocycle, and it can last up to a year or so. A mesocycle is a specific block of training to achieve a specific goal, and typically they're about a month long. And then a microcycle is the smallest, typically they're just about a week. So linear periodization is the most basic type of periodization, and it's a traditional method of program design that aims to gradually increase the intensity of the training load while simultaneously decreasing volume over a set period of time. Next up, we have undulating periodization, and this is a program scheme also known as nonlinear periodization, and it uses changes in volume, intensity, and exercise selection to provide loading differences on a daily or weekly basis. Daily undulating periodization is often known as a DUP or DUP program. So when it comes to linear periodization phases, this is the order you'd go in. You'd start off with hypertrophy, strength and power, peaking, and then recovery. And again, that's not always the case, but that is usually going to be the order you would go in. So for hypertrophy, you have high to moderate volume, and volume would be sets and reps. You have a lower load, and you have shorter rest times. Peaking, so this would be just before the event that you'd be preparing for. You have low volume, very high load, and longer rest times. In my opinion, none of this is worth memorizing, but good stuff to know. So basically know that linear periodization is a gradual increase of intensity and decrease of reps, and nonlinear or undulating is more all over the place. So the weight or resistance might look like this. In linear periodization, it's going slowly up over time, and it would generally go up in undulating periodization as well, but it wouldn't be that same steady increase. So when it comes to resistance training, there's four main principles that we should be thinking about. We have specificity, overload, variation, and progression. Specificity is movements should prepare clients for what they want to achieve. So if you're training a basketball player, obviously how high they can jump, something very relevant to their sport and something you should be training for. Overload, exercise should train or stress people beyond what they're used to. Yeah, if it's not pushing them beyond their normal limits, they're not going to make progress. So we do need some degree of overload. Variation, manipulate volume, intensity, frequency, rest, etc. And yeah, this is going to decrease boredom, and it's just going to help people make progress over time. Then lastly, you have progression, and progression kind of includes all of the other ones. You're going to use periodization to ensure or make sure things are made more challenging in a systematic way. I would actually memorize these four things. You don't necessarily have to memorize these exact definitions right here, but know the four training principles are specificity, overload, variation, and progression. So how many personal training sessions should somebody do weekly? A novice, 2 to 3 times a week is what they should be doing. Intermediate, 3 if they're doing total body, and 4 if they're using a different split. And then for advanced clients, 3 to 6 sessions a week is ideal. Probably not worth memorizing this one. Look it over a few times and make sure you know it. This one you actually would want to memorize though. So exercise order in a workout itself. First thing you want to do are all the power exercises. Anything very explosive, Olympic lifts, the snatch, push press, plyometrics, stuff like that. Those types of exercises are going to come first. After those, you'd move on to the core exercises, and core exercises are compound lifts. So these are the main big lifts that are going to kind of make up the bulk of a client's workout program: bench press, squat, deadlift, pull-ups, push-ups, rows, things like that would be core exercises, and they're coming up second. Third in the exercise order would be the assistance exercises, and these are accessory lifts, so typically they're single jointed, they're not as complicated. Curls, crunches, really almost all core work, lateral raise, tricep extensions, calf raises, wrist curls, stuff like that. So the smaller moves would be third. So power exercises, core exercises, the big compound lifts, and then last you'd be doing the assistance exercises. They're accessory lifts and typically single jointed and less complicated. So there's 4 different rep ranges that we need to be thinking about. We got to be thinking about muscular endurance, hypertrophy, muscular strength, and muscular power. And if it wasn't clear, these are the 4 different rep ranges for resistance training. So when it comes to muscular endurance, we have reps, we have sets. So a novice lifter is typically going to be looking for 10 to 15 reps, and they're going to be doing 1 to 3 sets. An intermediate lifter is going to be doing 10 to 30 plus reps. It's muscular endurance, so there's a potential for a lot of different reps there. And they're going to be doing more than or equal to 3 sets. So basically at least 3 sets. And then if you're training for muscular endurance and you're someone who's pretty advanced, it's going to be 15 to potentially even more than 30 reps. And you're still looking for at least 3 different sets. So not worth memorizing these numbers, but definitely good to have a rough idea of what they are. Same thing goes for hypertrophy or muscle building. So we got reps, we got sets. A novice lifter is going to be doing 8 to 12 reps if they're looking for hypertrophy, and they're going to be doing 1 to 3 sets. Intermediate lifters, it's 5 to 30 plus reps. It's a really big range. More recent research has actually shown that a bunch of different rep ranges can be just as effective for building muscle mass, which is what hypertrophy is. So yeah, 5 to 30 plus reps. In fact, actually, intermediate and advanced, they're the exact same for hypertrophy. Just look it over, at least 3 sets there for intermediate and advanced, and a big ol' rep range as well. Muscular strength, I feel like, is a little bit more straightforward. So when it comes to reps, if you are a novice, you're actually going to be doing less than or equal to 6 reps, and you're still looking for 1 to 3 sets. And then muscular strength for intermediate and advanced, I don't really like the way they have this described. Anyways, this is what it says in the book. So it's less than or equal to 3 to 6 reps. A little bit confusing and a little bit weird, but okay, whatever, that's what they want. Intermediate is greater than or equal to 3 sets. Again, pretty much what we've been looking at this whole time. And then for advanced, it is less than or equal to 1 to 6 for reps. Not worth memorizing. Look it over a few times because the odds of something popping up on the test, pretty likely. There's a good chance you're going to get a rep range question or 2 on the big test. Look each one of these things over a few times. Make sure you know them well enough. Then lastly, we have muscular power. We got reps, we got sets. So a novice lifter isn't going to be doing muscular power exercises. So they're not really going to be doing Olympic lifts or super explosive plyometrics. At least typically they wouldn't be. And then for muscular power, intermediate lifters, 3 to 6 reps, and they're going to be doing 1 to 3 sets. And then for advanced, 1 to 6 reps, because they could be working at an even higher intensity. Potential for a few more sets. So we got potential for 3 to 6 sets for advanced lifters with muscular power. Look it over a few times. Make sure you know it at least somewhat well, because there's a good chance you'll get a multiple choice question about it. Moving on to the 2 for 2 rule. This is a good one to go over because, yeah, it's probably going to pop up on that test in one form or another. Anyways, if the client can complete 2 more reps than the rep goal in the final set in 2 consecutive sessions, you want to increase the load by 2.5 to 10% in future sessions. So this is an example on page 411 in your textbook. We have a novice client doing the back squat in session 1. They're doing 135 for 10. They got 3 sets of that. And then we can kind of see these numbers progressing over time. So initially the rep goal here was 10, and now they're consistently getting 12 in the last set for 2 different sessions, session 3 and session 4. So we bumped that weight up. And then this chart would tell you how much you would have to bump that weight up. Probably not worth memorizing these numbers. I would look this one over a few times. And again, we had a novice lifter, so they would increase that weight by roughly 5%. Interestingly enough, if we go back to this example, which again, this is actually a direct example from the textbook, well, this is not exactly a 5% increase. It's actually a little bit more than that. So yeah, it's not an exact rule, but it does give you a pretty good idea of how you should be progressing clients. Anyways, next we're talking about rest between exercises. If your client is working on muscular endurance, you're actually gonna want less than or up to 30 seconds rest between different exercises. Or even the same exercise done back to back, less than or equal to 30 seconds rest for muscular endurance. So short breaks for that one. For hypertrophy, it's a bit different. Greater than or equal to 2 to 3 minutes for multi-joint. The big ones, we're talking squats, bench press, deadlifts, stuff like that. And then 60 to 90 seconds for single joint or assistance, bicep curls, calf raises, stuff like that. Not as much recovery time needed for those. Then we have muscular strength and muscular power, both things where you're pushing really hard, so the breaks are going to have to be a little bit longer there. So 2 to 5 minutes for both between strength and power moves. Coming up to some cardio and math stuff. I know you guys are super excited, so let's get into it. So we got a few different types of aerobic training. We got long, slow distance, pace tempo, intermittent pace tempo. Then we also have interval training, which high intensity interval training would be one of the parts of that. Probably the most popular part at this point in time. So for long, slow distance stuff, typically it's going to be 30 minutes to 2 hours, and it's going to be up to 2 times per week. The person should be able to talk comfortably, and it's not like they're trying to talk, but the intensity is not that high, so they should be able to talk if they want to. We got pace or tempo training. This can help to improve VO2 max, 20 to 30 minutes, so it's definitely a little bit shorter in duration. You're pushing quite a bit harder and should be at lactate threshold. Again, pushing fairly hard here. Got intermittent pace tempo. It's kind of more similar to interval training. So work bouts of 3 to 5 minutes followed by 30 to 90 seconds rest. And then you're going to repeat until that pace can't be maintained. Just like pace and tempo training, a little bit more intense, and you have a whole bunch of different bouts that you're doing. Then we have interval training, also high intensity interval training, 5 to 30 minutes, work to rest ratios of 1 to 1 or 1 to 8, kind of depends on what you're trying to do. The work portions should be at greater than or equal to 90% VO2 max. So if you're doing interval training properly, especially high intensity interval training, you're working really hard. This is a super intense workload. I think pretty much everyone watching this video right now knows what circuit training is. It's not as good for improving VO2 max, still good for a lot of different things, and it's actually good for maintaining VO2 max if you've kind of already built that up by doing cardio and other things. And look at this circuit training over here. We got some lunges, jumping jacks, squats, push-ups, cycling between a bunch of exercises like that really quick. That is circuit training. Cross training, at least according to the NSCA, is switching up different cardio modalities over time. So essentially I might be running on the treadmill on Tuesday, doing the upright bike on Thursday, and then the rowing machine on Saturday. So in cross training, usually you'd be doing multiple types of cardio each week. Math incoming. Make sure you know how to get max heart rate, which is 220 minus your age. Other things like heart rate reserve and target heart rate are likely to appear on the test. That said, they won't be on there too much, and you'll likely have to do long division and other mathematical work. Review this stuff a bit, but that's it. And if math is something you really struggle with, interestingly enough, I think you should devote less time to this stuff because there's not going to be that many mathematical questions on the big test. And yeah, you're just going to want to focus on the other stuff most likely. Again, if math is a weak spot. As I've said before, do what you feel is best for you. I've said it before and I'll say it again. Memorize the max heart rate formula, 220 minus your age. Heart rate reserve, the formula for that is your max heart rate minus your resting heart rate. That is worth memorizing as well because, hey, that's a pretty simple one. Heart rate max minus your resting heart rate. So 220 minus your age, that's your max heart rate. Heart rate reserve is your maximum heart rate, so the same thing you get right here, minus your resting heart rate. The maybe one to memorize is target heart rate, and that is heart rate reserve times the intensity percentage that you're looking for, depending on the question. And then you're going to add resting heart rate back to that number. And yes, target heart rate, that is a little bit more complicated. That one may or may not be worth memorizing, depends on how many mental resources you feel like you have to devote to that. Unfortunately, NSCA is likely to give you none of these formulas. Like I said, not too many questions on this stuff, but still pretty good to know. 220 minus your age, that is the most simple way to get someone's maximum heart rate. So that is the maximum heart rate that they can achieve during exercise. So let's say I'm working with a client who's 20 years old. 220 minus 20 is 200. So 200 would be that 20-year-old's maximum heart rate. There's other formulas that you can use to get someone's maximum heart rate. Here is one right here, and I won't lie to you guys, some of these other formulas are actually a little bit more accurate, but whatever, for our purposes and in taking this test, this 220 minus age is pretty much always going to be good enough. And it's also good to keep in mind that there are some heart rate intensity ranges. For example, the light intensity range would be 57 to 63% of your maximum heart rate. So if we took that 20-year-old we were just talking about and we were trying to figure out where they would be in this range, we would do 220 minus 20, that would give us 200, their estimated max heart rate. We would take 57% of that and 63% of that 200, and that would give us this range for that person. And this is what I was just talking about before, but now with moderate intensity, so the range there is 64 to 76% of HR max. So if we had a 28-year-old and their max heart rate would be around 187, and then we would take 187 times 0.64, that gives us 120. And then if we did 187 times 0.76, that gives us 142, and that gives us their range here, this moderate intensity range. Heart rate reserve is an important one, and you calculate your heart rate reserve by subtracting your resting heart rate from your maximum heart rate. Once you do that, you may need to calculate a percentage. So if I'm training a 25-year-old, their max heart rate would be about 195, 220 minus 25 their age, again gives us 195. Let's say their resting heart rate is 65, so we would take that 195, their max heart rate, subtract their resting heart rate, 65, and that gives us 130. So now we're going to talk a little bit more about heart rate reserve and target heart rate. So the formula for target heart rate is right here, and basically heart rate reserve times the intensity percentage that you're looking for, and then after that you're going to add resting heart rate back to that number. So if we took that 130 heart rate reserve from the last example and we multiplied it by 0.4 or 40%, which would be the low end of moderate when using heart rate reserve to calculate intensity, and then we added back that person's resting, which is 65, we get 117 beats per minute. And then if we did the same thing with 0.89 or 89%, which would be the upper end of vigorous when using heart rate reserve to figure out intensity, we'd get 181 beats per minute. I know, pretty advanced stuff, and you're likely to get one question at most on target heart rate and probably very few on heart rate reserve too. If you feel like you have a chance of getting those questions right, watch this math stuff over a few times. Otherwise, move on and focus on everything else. Next up, we have RPE, or rating of perceived exertion. So you can rank things on a 1 to 10 scale, which I feel like that one's pretty self-explanatory. 10 is hard, 1 is super easy. And then you can also rank things on the Borg scale, in which case 6 is very easy and 20 is very, very hard. And you should definitely know and understand all of that. So when it comes to aerobic training, even resistance training to some extent, you're going to want to start most clients off light to moderate. They should be able to talk a little bit, but not sing. Gasping for words is vigorous intensity. And again, you can kind of tell where that would come in down here. And we don't need to necessarily give exact numbers for all of these things because they don't exist. But again, you get the general idea. Okay, so next up we have METs. METs are metabolic equivalents of a task, and METs are actually pretty similar to calories. METs tell you how much exercise is being used, or the intensity of a certain activity. And these are probably not worth memorizing. Very light intensity would be under 2 METs. So if I'm sitting on a couch, usually I'm just using like 1 or 2 METs at the most. Light intensity would be 2 to 2.9 METs, and again, you can see RPEs here, which we just talked about. And we could just keep going down the list, but again, probably not worth memorizing. Good one to look over though. This one is worth memorizing. Recommendations for cardio. Moderate intensity, 30 to 60 minutes, 3+ days a week, or 150 to 300 total weekly minutes. Make sure you know that. For some healthy people, vigorous intensity might be the preferred method. And when it comes to vigorous intensity, 20 to 60 minutes, 3+ days a week, 75 to 150 total weekly minutes. And you actually can kind of mix and match here a little bit too. It's not like you have to strictly do one or the other, but these are the minimum guidelines if this is your thing. And again, memorize both of these pieces of information. And like I just said, you can do some moderate and some vigorous. You don't have to strictly do one or the other. Weight loss clients are going to want to be on the higher end of that range we just talked about. So 50 to 60 minutes daily, 250 to 300 minutes weekly. More advanced clients may be higher up on those ranges, and I feel like that one's pretty self-explanatory. And this is going to be true for beginners especially, but if you have to break up cardio, try for multiple 10-minute bouts. Again, if someone's really deconditioned, they might not be able to exercise for that long, so they might just have to do 10 minutes at a time and do a few of those bouts throughout the day. And now we're moving on to some stuff in the initial consultation. So according to the NSCA, there are 4 factors that dictate consultation implementation. We have credentials of the PT, who are you certified by, stuff like that. Site of delivery, where do you practice out of, do you work in a gym, for yourself, etc. The population that you're working with, and legal statuses. So credentials of the PT, site of delivery, population served, and legal statuses. Read those over once or twice, make sure you know them. Some consultation steps to consider: schedule the appointment, conduct the interview, do health appraisal forms, evaluate for risks, disease, lifestyle, assess and interpret the results, refer out when necessary, obtain clearance, and recs. By the way, oftentimes you're not going to have to refer somebody out. That's just if they are high risk or they have medical things going on. In that case, these last 2 steps wouldn't actually be relevant, but obtaining clearance and recommendations from a doctor, yeah, if you have to refer someone out because they have heart disease or something like that, you are going to want clearance from a doctor and some recommendations too. Look these over a few times, but don't memorize them. Trainer-client compatibility. Explain what you offer, explain your education, experience, certs, specializations, mission statements, success rate, etc. These are just things you're explaining to your client when you're sitting down with them initially and chatting about personal training and obviously what you offer. Talk where, when, how. Determine exercise readiness. So basically you're trying to figure out how ready is this person to change. Then you're going to assess suitability and appropriateness, essentially boundaries. You don't want this person texting you at 10 o'clock at night, Friday night. That would just be kind of weird. So talking about all of these sorts of things, yeah, that's going to determine how good of a match you are for this potential client. Don't memorize all this stuff. Look it over a few times. Good to know. If compatibility and sustainability are established, we next move on to goal setting. So next up, we're talking about SMART goals. So specific, measurable, attainable, realistic, and timely goals. And you do want clients' goals to be SMART goals. When we're talking about specific, someone's saying they just want to lose weight. Well, that really might not be good enough. They're more likely to actually lose weight if they know roughly how much weight they want to lose. Maybe they want to lose 20 pounds. So again, you have to kind of figure that out with your client. Measurable is pretty easy for us because most metrics in our world are very easy to measure. Again, if someone's trying to lose weight, pounds would be the measurement that you're looking at. Obviously, if someone's main goal is to improve their bench press, you're also looking at pounds there, but now you're looking at pounds added to the bar over a period of time. Attainable is pretty simple. You want to set goals that are actually possible to achieve, so just keep that in mind. R can stand for realistic or relevant. I have realistic down here, but oftentimes relevant will also be the thing that it could stand for, so keep that in mind. Anyway, your goal should be realistic or relevant to your life or the life that you're trying to move into. And then for timely, give yourself time to achieve a goal, but you should have some sort of a deadline, even if it's just a soft deadline. Also, when it comes to exercise readiness, we have the Transtheoretical model. And this is something you're very likely to get at least one question about. By the way, there are 5 stages to the Transtheoretical model. So those 5 stages are pre-contemplation, contemplation, preparation, action, and maintenance. First up, pre-contemplation, and this is where people are physically inactive. They're not intending on beginning an exercise program, and they don't see exercise as worth worth their time. After pre-contemplation, you have contemplation, which I feel like makes sense. Here, people are inactive, but thinking about becoming more active in the next 6 months. They're still weighing the pros and cons of exercise, but they're starting to consider the benefits. After contemplation is preparation. People in this stage are doing some physical activity and preparing to adopt a more consistent activity program. These people are only doing things like sporadic walking, but they're ready to adopt an active lifestyle. After preparation, you have the action stage. People are here when they're engaging in regular physical activity, but have been doing so for less than 6 months. So remember that, less than 6 months if they've been doing physical activity. Action stage. Lastly, you have maintenance. Should say people in this stage, not on this stage. Anyway, people in this stage have been working out consistently for longer than 6 months, and just make sure you can identify where someone is in this model. So if I have a client and they've been working out consistently, but just for 2 months, technically they would go in this action stage because, again, they haven't been doing it for at least 6 months. And then, of course, if I have someone who isn't thinking about working out at all, they'd go in this pre-contemplation stage. So now we're moving on to pre-participation health screening. And as you might have guessed, there are some forms here that we have to focus on. First up, we have the PAR-Q, and this is a subjective yes or no questionnaire that is used to determine whether it's safe or not for a client to begin an exercise program. It does have some follow-up portions to reduce false positive readings. And again, the most important things for you to know here, it's yes or no. And again, there are some additional portions. So yeah, all good things for you to either memorize or know very well. Now we're talking about the health history questionnaire, also called the HHQ, or the health history evaluation. It has a few different names. It's pretty similar to the PAR-Q, but it's not yes or no questions. It gets you more detailed information on your client. Things like what medications they're taking, family history, etc. are covered. So the HHQ, or health history questionnaire, is also called the health or medical questionnaire by the NSCA. There's also lifestyle questionnaires that focus on stress, diet, exercise, and other related things. So the informed consent is an important one for you to know. This gives clients information about the content and the process of the program that you're going to be delivering. So some essential elements or things that you would find in the informed consent are a detailed description of the program, the risks and benefits of the program, a confidentiality clause, responsibilities of the client or participant, and documentation or acceptance of the form itself. You also have the assumption risk, or the waiver, also which it's known by. This is an agreement by the client to give up their rights to legal remedy or damages, even when it's due to trainer negligence. So a waiver or an assumption risk form could potentially give you some extra protection if someone was to sue you. So a waiver or an assumption risk form needs to identify the risks associated with participation. It has to establish that the client understands them and that the client voluntarily assumes responsibility for the exercise program that you're about to undertake with them. So if something goes wrong, they understand that it's kind of on them. They're taking the risk. So on your big NSCA test, you're going to have to identify risk factors for a client or a potential client, and these are numbers that you're either going to have to memorize or at least know them pretty well enough to get a multiple choice question correct. So what you're seeing right now are risk factors for cardiovascular disease. So again, really important to look these over. I am going to read them off to you. So when it comes to age, if your client is a male 45 years or older, or a female 55 years or older, that would count as a risk factor for cardiovascular disease. Next up, we have family history, and if your client has a first relative, so a parent, child, or sibling, with heart disease prior to age 55 if that relative is a male, or 65 if that relative is a female, if they have a first relative who's had heart disease prior to these ages, that would also count as a risk factor for cardiovascular disease. If your client is a current smoker or they quit within the last 6 months, that would also count as a risk factor for cardiovascular disease. And actually, if they live with someone who's a smoker, that secondhand smoke would also count as a risk factor. So that is a good thing to know. If your client is sedentary or they do less than 30 minutes of moderate intensity exercise 3 days a week for 3 months, if they're not doing at least that amount, they're sedentary, and that would be considered a risk factor. Next up, we have obesity, and your client would be considered obese if their BMI is greater than or equal to 30, if they have a waist circumference over 102 centimeters or 40 inches if they're male, or 88 centimeters, 35 inches if they're female. If any of those things are true of your client, that would count as a risk. Next up, we have hypertension or high blood pressure, and if your client's blood pressure is greater than or equal to 130, that would be the systolic number or the top number, or if their bottom number, the diastolic number, is greater than or equal to 80, or if they're on meds. If any of those three things are true, then your client potentially has hypertension, and that would count as a risk. Next up, we have dyslipidemia, or bad cholesterol, essentially. And if their LDL being bad cholesterol, is greater than or equal to 130, or if their HDL is good cholesterol, if that number is under 40, because you actually want your HDL number to be on the higher side, since HDL is good cholesterol. Anyways, if either of those two things is true, person has dyslipidemia, that counts as a risk. Also, if they're on medication for their cholesterol or anything for that matter, count that as a risk. So if they're on blood pressure medication, count that as a risk. Now, oftentimes people are only going to know their total cholesterol number. If their total cholesterol number is greater than or equal to 200, count that as a risk for dyslipidemia or cholesterol. Now on the bottom here we have diabetes, or let's just say the potential for diabetes. If someone's fasting blood glucose is greater than or equal to 100, that would count as a risk. Your OGTT, A1C, these ones I don't necessarily think are worth memorizing. They tend to not appear quite as often on these big tests. Maybe just look them over a few times. These are numbers that you're either going to have to memorize or at least know them pretty well enough to get a multiple choice question correct. For example, let's say I gave you this client, a male, 48 years old, they have a BMI of 29, they quit smoking 5 months ago, their fasting blood glucose is 128, their LDL cholesterol is 100, and their HDL is 50. How many risk factors would this person have? Male, 48 years old, so they're over 45, so that would count as a risk factor. They have a BMI of 29, and that is less than 30, so no risk factor there. They quit smoking 5 months ago. That would actually count as a risk factor because it's within the last 6 months. So yeah, this person was a fairly recent smoker. If it's not 6 months or longer, count it as a risk factor. And if they're right on the 6-month mark, I would still count it. Fasting blood glucose of 128. Yeah, that would definitely count as a risk factor because it is over 100. This person potentially has diabetes. They'd have to, of course, see a doctor to confirm that. And that's because we can't diagnose anything. We can't diagnose hypertension. We can't diagnose diabetes. That's not our job, but it is potentially our job. In fact, it's absolutely our job to kind of figure out if someone has risk factors and if we have to refer them out before starting exercise. So their LDL cholesterol or their bad cholesterol is 100, and that is not so bad. It's not greater than or equal to 130. Their HDL is 50, and that's pretty good too. That's over 40, so their cholesterol is just fine, not a risk. So their age, 48, that's going to be their first risk factor right there, so that's 1. This person only quit smoking 5 months ago, so that would be their second risk factor. And then their fasting blood glucose is 128, and that is over 100, so they have 3 risk factors far as we can tell. And on the big test, you're likely to get a question pretty similar to that. At the very least, you're likely to get 1 or 2 questions where you have someone's blood pressure and you have to kind of identify if they have high blood pressure or not. Same goes for diabetes, if they are sedentary, if they have obesity, be it their BMI, their waist circumference. So look these numbers over a few times, listen to me say them, play it back. Make sure you understand it because this is going to come up on the big test in one form or another. So we actually just talked about this briefly, but when it comes to cholesterol, you have LDL and HDL. LDL is often known as bad cholesterol and HDL is good cholesterol. Because of that, if someone has an HDL greater than or equal to 60, it is a negative risk factor. So technically, it would subtract a risk factor from their overall list of risk factors. So when should you refer out? If someone says yes to something in the PAR-Q Plus or just the PAR-Q, either one, most likely you will have to refer out. That's not always a cause for referral. The PAR-Q Plus has a few different sections, but yes, if someone says yes on the PAR-Q or PAR-Q Plus, most likely you'll be referring out. If they have signs or symptoms of CVD, cardiovascular disease, metabolic, renal disease, or they have a disease that they're aware of that could be impacted by exercise or it could impact them exercising, yeah, if that's the case, you should refer them out before starting a program. Not all conditions are equal. A person who just has slightly elevated blood pressure or cholesterol is probably okay to start working out at a light intensity, and someone who has type 2 diabetes should be referred out initially. Start everyone who is inactive coming in at a light intensity, assuming that they don't need clearance first. You have to progress to a moderate or vigorous intensity over time. Again, anyone who's inactive coming in, starting out at a light intensity, progress them to moderate and vigorous over time. And then also super important, when in doubt, refer out. I repeat, when in doubt, refer out. Next up, we're getting into assessments, and we have quite a bit to discuss here. And a lot of this stuff is pretty important. So when it comes to assessments, we have reliability and validity. Reliability is a measure of the repeatability or consistency of a test or observation, and validity is the test measures what it's supposed to measure. So stopping an exercise test or an assessment. These are things that are not worth memorizing, but they are good to look over a few times. Good to hear me read them off to you because they could pop up on the test in one form or another. Anyways, angina is chest pain. If your client is having chest pain when they're running on a treadmill or really doing anything, yeah, you're going to want to stop the exercise test. If they have a drop in blood pressure, we're talking the systolic or the top number, or they have an excessive rise in their systolic blood pressure, again, that is the top number. If it's going over 250, which is super, super high, or if the diastolic, that bottom number goes over 115, super high, yeah, if any of those things happen, drop in blood pressure, this amount or more, if the blood pressure numbers go over this amount, yeah, you're going to want to stop. If the person requests to stop, if they have shortness of breath, wheezing, leg cramps, claudication, which is essentially like pooling of fluid or blood in the person's legs. Shortness of breath, of course, you'd have to use your best judgment. If someone's running 1.5 miles, they're probably going to be a little bit short of breath. But these other things, yeah, they are reasons definitely to stop an exercise test. Poor perfusion, that would be a reason to stop as well. Lightheadedness, confusion, nausea, etc., all reasons to stop. By the way, poor perfusion basically means poor circulation, so some of these things could go along with that, but if someone's getting extra pale or something along those lines, poor perfusion or poor circulation could be what's going on there. If someone's heart rate doesn't go up as you're making them do exercise that is increasing intensity, or if they're just continuously exercising, yeah, that could indicate that something is going wrong. So that would be a reason to stop. Change in heart rhythm, same thing, reason to stop. Severe fatigue, verbal or just visual signs, yep, definitely want to stop. Equipment failure, yeah, if the equipment breaks, you're gonna want to stop. So the sequence of assessments for general fitness or regular clients, this is actually something you're going to want to memorize. This is the order in which you would do assessments. You're going to start off with the resting ones, so resting heart rate, blood pressure, body composition, etc. Then you're going to move on to the non-fatiguing ones, so flexibility stuff like the sit and reach, balance stuff. Then you're going to move on to the strength ones, so 10 rep max, bench press, local muscular endurance stuff, so the partial curl up test, which we're going to go over that. That's essentially a bunch of sit-ups. You have the submax aerobic stuff that's going to be last. So step test, Rockport, walk, pretty much all that good stuff. Again, resting stuff first, non-fatiguing, flexibility, balance, all that good stuff. Strength is up after that. Then you have local muscular endurance, and then you have submax aerobic. This is really just common sense. Look it over a few times and it should just kind of click in your head. Don't go crazy, but definitely good to know. Now for athletes, the assessment order is pretty similar, but not the exact same. We're still going to start off with the resting ones. We got the non-fatiguing ones second, so flexibility, balance, all that good stuff. Third up, we have the agility ones, which we're going to, of course, go over what those are. Then we're moving on to the power, so 1 rep max bench press, blah, blah, blah. Next up after that, we have the sprints, so 40-yard dash, stuff like that. Then we have local muscular endurance, push-up test, any of that stuff. Then you have anaerobic capacity, and then you have max or submax aerobic coming up last, actually. Look this over a few times. Should you memorize it? Yeah, to some extent. Basically, you should just have a general idea of what assessments, should go first and which ones should go kind of towards the end, because you could be asked a question about this. It is mostly common sense once you look over it a few times. Don't go crazy. Don't rack your brain with it, but it is good to know. So taking a client's heart rate, typically their heart rate is going to be 60 to 80 beats per minute. You have bradycardia, and that's a very slow heart rate, which would be under 60 BPM. Or beats per minute. There's also tachycardia, which is the exact opposite. That's a heart rate that is high, so over 100 BPM. So there's a few different ways you can take someone's heart rate. You have the brachial artery, you have the radial artery. This is really the one that we're going to be using the most, and that's kind of why I have its location down here. So it's the lateral wrist, beneath the base of the thumb, the carotid artery, that's your neck, got the temporal artery. Don't really need to know too much about these. Again, the radial artery, I would memorize that one's location because that's the one we use the most often. And you can get someone's heart rate in a bunch of different ways. So if you take someone's heart rate or kind of listen to their heartbeat for 6 seconds, you can multiply that number by 10. But there's a bunch of different ways you could do this. You could get their heart rate for 10 seconds and then multiply that number by 6. Doesn't really matter. You can use whatever mathematical formula floats your boat. Normal blood pressure would be where your systolic, that top number, is less than 120, and that diastolic number, that would be the bottom number, that's going to be less than 80. That would be normal blood pressure or not a risk. Then you have elevated blood pressure, and this person isn't at risk yet, but they are well on their way, and their systolic number, that top number, is going to be 120 to 129. And again, their diastolic number would still be under 80. Then you have stage 1 hypertension, and you can see the numbers there for that. Stage 2 hypertension, and again, you can see the numbers there for that. And then you have a hypertension crisis. So this is like where someone's blood pressure is very dangerously high. And again, you can see numbers here for this. Should you memorize these numbers? Probably not. Again, it's good to know them, but probably not worth memorizing. I think in terms of blood pressure, if you're going to memorize something, this is the one to go for right here. If your blood pressure is greater than or equal to 130 systolic, top number, or 80 diastolic, bottom number, or if you're on meds, that is you being at increased risk. So waist to hip ratio risk, I don't know that I would memorize anything on this because NSCA doesn't seem to care about this quite as much as some of the other organizations. Anyways, to get someone's waist to hip ratio, well, it's pretty much exactly what you'd think. You divide their waist measurement by someone's hip measurement. So these numbers down here, if someone has a greater than 0.86 for a woman, or a 0.95 for a dude, that's bad. But these numbers do vary depending on what resource you're looking at, so I wouldn't bother memorizing them. But it is good to have a general idea of what is bad because, hey, you never know, you could be asked a question about it. There is no official units for waist to hip ratio. You could do it in inches, centimeters, doesn't really matter because it is a waist measurement divided by hip measurement. So doesn't really matter what measurements you use. BMI or body mass index, this is an interesting one. So you have two different formulas you can use here to calculate someone's BMI, and that is something that you might actually have to do on the big test. Personally, I like this bottom formula more, and that's because you don't have to worry about meters or anything like that. So again, this bottom formula is usually my go-to, and you can see I actually plugged my information into this equation down here. So 703 times 180, I weigh 180 pounds. I am 5'10", so 70 inches squared. And then if we multiply these two numbers together and divide that number by the square root of 70, we get 25.82, and that would be my BMI. And I'm not saying like I'm some physical specimen or something like that, but this is me just a few months ago. I look the same now. And yeah, I'm clearly in at least halfway decent shape and not overweight. And that is the thing you need to know about BMI. BMI doesn't take body fat percentage into consideration at all. BMI is all about your height and your weight, and that's it. So if you're someone who has a lot of muscle mass, like The Rock, for instance, you're almost certainly going to end up in this obesity category, which again, we all know The Rock isn't actually obese. He has a ton of muscle mass on his frame and incredibly low body fat. So BMI is kind of one of those weird things. But again, you might need to calculate someone's BMI on the big test. I don't necessarily think you need to memorize these numbers, but there are a few important ones here. So if someone has a BMI under 18.5, they're considered underweight. If their BMI is between 18.5 and 24.9, they're in the healthy range. If it's between 25 and 29.9, they're considered overweight. If it's between 30 and 39.9, they are obese. And if it's 40 or over, they are severely obese. I would memorize that 30 and over means they're obese. I would memorize that 25 to 29.9 means they're overweight. And I would also memorize that 18.5 and under is underweight. And then if you kind of know those pieces of information, you can figure everything else out. Moving on to skin fold. So there's 8 potential sites for pinching, and there's different types of pinches. You got vertical folds, you have diagonal folds, you have horizontal folds. Just depends on how you're gripping the skin before grabbing it with the caliper. Don't really need to memorize which one is which. It is something that is probably worth looking over once or twice because, hey, you never know what NSCA is going to ask you about, but again, not super important. And for more information on skin folds, 209, 249, there's a few different pages in the book. Anyways, there's 8 sites that we have to think about. We have the abdominal, we have the triceps, we have the chest and pecs, the medial calf, we have mid-axillary, subscapular, suprailiac, the thigh. For white men, which is kind of weird that they have it labeled that way in the book, but again, this is the way it is in the book, guys. I didn't do it this way. 3 site locations for dudes: chest, abdomen, thigh. Essentially, you're going to get measurements on those 3 spots if you want to figure out estimated body fat percentage for dudes, specifically white dudes, according to the NSCA. Anyways, I got some more information on the next page, but for kids 6 to 17 years old, you're just using 2 sites, tricep and calf. These are just examples. I wouldn't bother memorizing either of these things, but just kind of showing you the way this works. And again, skin fold is a way to potentially find out someone's body fat percentage. You're pinching a bunch of different sites in the body, and then you're using that information to estimate someone's body fat percentage. Anyways, a little bit more on skin fold. Measurements are always done on the right side of the body, at least 2 measurements per site. So if I'm measuring someone's triceps, I'm doing that twice. If the values vary by more than 2 millimeters or 10%, you're going to take a 3rd measurement. Another thing, you're not going to want to measure someone when they're really sweaty, so right after exercise, not going to want to do that. Or if they're wearing clothing that's really slippery, because sometimes you are taking measurements through clothing. Yeah, just some other things to consider when doing skin fold. And obviously, if you're going to actually do this with a client, you're going to be using the book, so we don't need to know all that much to get through this test. But if you're actually going to do this with clients, yeah, you're going to have to go back and review a little bit more in the book before you do that. Bioelectrical impedance is an interesting one. Basically, if you have one of those scales or one of those handheld things that's telling you your body fat percentage, it is using a technology called bioelectrical impedance, or BIA. So the way it works is it basically determines your body composition based on the rate at which an electrical current travels through the body. Body fat or adipose tissue causes greater resistance, impedance, than fat-free mass and slows the rate at which the current travels. It does require specific testing arrangements. And a lot of this just comes down to hydration. If someone is dehydrated, they're going to show up as fatter thinner than they actually are. If someone is overhydrated, they're going to show up as leaner than they actually are. So some more bioelectrical stuff, or BIA. You're going to want the person you're testing to not eat or drink within 4 hours of the test. They can't exercise within 12 hours of the test. No alcohol within 48 hours of the test. No diuretics within 7 days of the test. Don't test females retaining water due to their cycle. Tell clients to pee 30 minutes before their test. All of this has to do with hydration. And if someone is overhydrated or underhydrated, again, it's going to just make this person seem more fat or less fat than they actually are. So all of these things are important. Look them over a few times. Are they worth memorizing? Probably not. Good to look them over a few times. So VO2 max is the most valid measurement of aerobic fitness, also known as maximal oxygen uptake or peak VO2. This is not something that will be done with typical clients. Now we're just taking a quick glance at some VO2 max scores, and it's really not important to memorize any of these. And this lower one here, this would be guys, this one would be girls up top. Again, don't bother memorizing anything on this chart, but you know, if you saw someone with a VO2 max of, let's say 40, let's say they were a 30-year-old female, that would put them in this excellent category, and it might be a good idea just to have a general idea of what a good or bad VO2 max score is. So you should know what the upcoming assessments are, but you don't need to be an expert on any of them. There's a whole bunch of them, and we're going to go through them pretty quick. Just good to know what they are in case one of them pops up on the test, which is very likely to happen. Next up, we have the A-strand rhyming submaximal cycling protocol. That is a lot of words, and it is created by A-strand and rhyming, which, hey, that makes sense. It's also single stage, it's simple, it lasts for 6 minutes, and it uses heart rate response, and it measures cardiorespiratory fitness. And if it wasn't clear, in my opinion, you should know what these assessments are, but again, you don't have to be an expert on any one of them. Next up, we have the YMCA cycle ergometer test. It's designed to progress clients to 85% heart rate max over 3 stages. It's used to estimate VO2 max, body weight, RPE, rate of perceived exertion, and blood pressure readings are all essential. Moving on to the 1.5 mile run test. This is best for fitter clients, which makes a lot of sense. You wouldn't want to have someone who's totally out of shape trying to run 1.5 miles. It estimates aerobic fitness levels by scoring the individual's timed performance or their heart rate response, which is used to estimate VO2 max. Good to know that this one can help you estimate VO2 max. Next up, we have the Rockport walk test, and this is a 1 mile walking test also to predict VO2 max. Since this one is walking and not running, it is appropriate for new exercisers, which is good to know. It's likely not going to work as well for fit individuals though, and it can be done on a treadmill, which you can see right over here. By the way, someone's mile time and heart rate are what are used to predict the actual VO2 max here. Next up, we have the YMCA 3-minute step test, and that is 3 minutes of stepping on a 12-inch step to a 96 step per minute cadence. So after 3 minutes, you're going to take someone's pulse within 5 seconds post-test to determine aerobic fitness. And this one is possibly good for deconditioned clients, and that's because it's not terribly difficult. Still a 12-inch step though, and it could be too difficult for some people, so this is one you're going to have to think about if it shows up on the test. Next up, we have the 12-minute run/walk. It's designed to measure the distance traveled over 12 minutes, and that's again why there's a combination potentially here of running and walking. This determines a VO2 max estimate based on a chart, so you're going to have to go into the book to actually kind of see where somebody ranks, and this is typically done on a track. In fact, it's always supposed to be done on a track. Next up, we have the 1 mile run, and I feel like pretty much everyone has done this at some point for gym class in middle school or high school. That's what this is. There's a chart in the book to kind of show you where you rank and where you should rank. Again, we all know what this one is. This is for kids mainly, and yeah, again, you've probably done this one. So we have the 40-yard dash. That tests reaction capabilities, acceleration, and maximal sprinting speed. The 40-yard dash is 100% a speed assessment. Next up, we have the Pro Shuttle assessment, and this assesses acceleration, deceleration, control, and agility. It is definitely an agility assessment. You'll also see it called the 5-10-5 assessment. The Pro Shuttle assessment, again, we said that one is agility. The 40-yard dash, again, we said that one is speed. Both of those two are considered advanced. You would not be doing them with most clients. We've also got the 300-yard shuttle, and this tests anaerobic capacity and direction change. Essentially, you have someone sprinting 25 yards forwards, then backwards, and they're going to be doing that 6 times. There's also the T-test, and this is sprinting, side shuffling, and backpedaling in a T-shape, and it does test speed and agility. Both of these assessments are considered advanced. You're not going to have your 87-year-old client attempt either of these. They're for athletes. So we have 5 rep max bench press and leg press. Both estimate 1 rep max, and both are muscular strength assessments. Essentially, you're going to have clients do 5 reps of bench press, which is going to get really, really tough at the end. They're pushing it to the max, or leg press, and you're going to use those numbers to estimate their 1 rep max. So the steps for these two things, the bench press and the leg press, you're going to have them warm up with light resistance, do an easy 8 to 10 reps. You're going to give them a minute rest. You're going to estimate weight for 6 to 8 reps based on what step 1 looked like. And then you're going to add 5 to 10 pounds for bench press and 15 to 20 for leg press. The client is then going to rest for 2 to 4 minutes. You're going to increase the load by 5 to 10 pounds for bench, 15 to 20 for leg press. And after that, you're going to try for the 5 rep max. Do not memorize these steps. Good to look them over, and it's good to kind of just know some of the numbers here. So it's good to know that for bench press, it's going to be 5 to 10 pounds typically that you're going to be increasing things by. For leg press, 15 to 20. It's good to know some of these rest periods. 2 to 4 minutes typically is what they're going to be kind of using as a rest period as you're trying to figure out their 5 rep max. Those are really the things to know. You don't have to memorize this protocol. If you're going to actually do this with a client, you're going to go back and use the book anyways. So when using a 5 rep max, this would actually work for a 10 rep max as well. To estimate someone's 1 rep max, you may have to take some more 2 to 4 minute rests and add some more weight. Again, 5 to 10 pounds for bench press or upper body moves, and 15 to 20 pounds for leg press or big lower body moves. Ideally, you'll get a 5 rep max in 3 to 5 testing sets, and you want to do that because if you do much more testing than that, muscle fatigue is going to make the results a lot less reliable or a lot less accurate. Anyways, when in doubt, don't do these assessments with people. 5 rep maxes, 10 rep maxes, 1 rep maxes. When in doubt, don't do them with people. Typically, we're not going to want to have clients do the Valsalva maneuver, and that is when they're breathing out strongly through their mouth while holding their nose tightly closed. This creates a forceful strain that can trigger your heart to react and go back into normal rhythm. It can potentially allow you to lift a teensy tiny bit more, but it can raise blood pressure. Yeah, Valsalva maneuver for our clients, not so good. So this is definitely something to remember, pops up on tests pretty often. Onto the vertical jump test, which is pretty much what you'd think. You're going to have your client start off with 3 to 5 warm-up reps at about 50% intensity. They're going to have some chalk in their dominant hand. They're going to start things off by kind of reaching their hand up and marking the chalk so as high as they can reach, and they're doing that from a standing position with both feet planted. Then they're going to jump up high as they can, still holding on to that chalk, and they're going to mark the wall with that chalk. And of course, the difference between the two marks, that is as high as they can jump. They're going to do that 3 times with 60 seconds between trials. And yeah, you take the best one, compare it to the standing height, and that is the result. Okay, so moving on to the long or broad jump test. Same thing, you're going to do 3 to 5 warm-up reps at about 50% intensity. You're going to have your client standing with their toes at the start line, which could be marked by tape or paint. Both hands at the sides for your client, and you're going to have them do like a partial squat or a counter movement, which actually you're going to have your client doing a partial squat or a counter movement in the last one as well, and they're going to jump forwards as far as possible. So they're not getting a running jump. They're kind of squatting down partially, and they are launching themselves forward as far as possible. Same thing in the last one. Before they were just going upwards, now they're going forwards. Anyways, you're going to record where they land at the back heel, and just like before, it is the best of 3 trials. Next up, we're moving on to the med ball chest press. We got 3 to 5 warm-up reps at 50%. Yep, keep on saying that because that's pretty much what you have to do for all of these. The client's going to lay on an inclined bench at 45 degrees. Their back, head stay connected to the bench, and both feet stay planted to the floor. The client is going to throw the ball as far as possible. It's the best of 3, and there are 2 minutes between trials just so your client can at least mostly recover, if not fully recover. Moving on to the YMCA bench press test. This is going to measure upper body muscular endurance. Men are going to use an 80-pound barbell, women a 35-pound. They're going to be pressing that barbell at a 60 beats per minute tempo. Probably not insanely important to know, but 30 reps per minute is what they're going for, and then essentially they're just going as long as they can at that tempo, and you're going to take their total rep count, and of course there's a chart in the book for measuring upper body muscular endurance. Moving on to the sit-up test, it's 2 minutes long. Knees are bent at 90 degrees, arms are crossed, hands on the shoulders, and the trainer is going to hold the client's feet. They're going to go until their elbows touch their thighs and the torso and shoulder blades come off of the mat. It's as many reps as possible in 2 minutes. We got the prone double leg straight leg raise. A lot of words there. Since they're prone, the client is going to be laying face down as opposed to supine where someone is laying on their back. Prone, face down, supine, laying on their back. Anyways, arms folded and hands under the forehead of the person doing the move. Client raises both legs. So they're laying on their stomach and they're raising both legs up into the air. And that's until the knees lift off of the mat. You can do it on a massage table as well. The client is going to hold that position with their legs lifted up in the air for time, for as long as they can. And this kind of tells us about their low back endurance. So the endurance of those low back muscles. And it could be useful for determining if someone is going to have low back pain. Moving on to sit and reach, and we've all done this one at some point, I think. Anyways, it's going to test someone's hip and low back flexibility, obviously their hamstrings too. No shoes, so it's done barefoot. Can be done with a yardstick and tape. Obviously, you can use one of these things as well. Knees are locked, and it's the best of 2 trials. We have the back scratch test. Essentially, it's where you're trying to kind of reach your 2 arms together. One goes up high, one goes down low, and of course it's happening behind your back. This one shows upper body flexibility and shoulder range of motion. You're going to measure the distance between the 2 hands. Again, they're both going behind your back. One's going high, one's going low. This one can be done a handful of times, not as definitive as to how many times, and you're going to have your person warm up a little bit first. Moving on to the plumb line assessment. So you're looking at your client from the front, the side, and the back, and you're going to analyze their posture. You're going to start with the lateral view and look for things like an overly kyphotic or lordotic posture. NSCA isn't super big on posture in general, so I'm just going to go over everything with you a little bit, but don't go insane memorizing everything I'm about to break down for you. Anyways, kyphosis is a good one to know. That one can always pop up on the exam. We'll talk more about that in a sec. Scoliosis as well, which is this sideways deviation of the spine. You should really kind of just have a general idea of what that is. We'll also break down an overly lordotic posture because that one could also pop up on the test. Anyways, if the hip flexors and lumbar extensors are too tight and short, you could end up kind of with this overly lordotic posture right here. We're all supposed to have a curve in our low back here that goes inwards, but this person's curve is a little too big, and that can have some negative consequences. Don't memorize all this stuff, but it's good to just have a general idea of what's going on here. So a kyphotic posture is this overly rounded forward posture, and again, you can see that right here. So basically what's happening there is the anterior chest and shoulder muscles, lats, and neck extensors are too tight and shortened. And again, this one makes sense. If everything on this front side here is too tight and shortened, I'm gonna be kind of just like stuck in this position like this. Again, that's what someone with kyphosis has going on. These guys right here on the front side, too tight, too shortened. So if we already said that these muscles in the front side are too tight and shortened, these muscles back here that are on the opposite side of the body, they're going to be overly lengthened, stretched, and weak, and that should make sense based on some of the stuff that we talked about earlier in this video. We have the closed kinetic chain upper extremity stability test. A lot of different words there. This one is going to assess shoulder stability and injury risk. Essentially, you're tapping alternating pieces of tape as many times as possible for 15 seconds. And you can see this dude doing that down here. So just good to know what this one is, and good to know that it's about shoulder stability and injury risk. Moving on to the single leg squat and the forward step down. These are going to assess movement quality in the lower limb. You're going to have your client squat to at least 45 degrees. This is in the single leg squat, and that would be for knee flexion, but not greater than 60 degrees. So again, they're bending down, and it's not as much as what you'd expect in a typical squat. Anyways, you're going to have your person doing 2 to 3 practice trials, and they're going to hold the bottom position for 5 seconds. You're looking for movement issues. So if their hips are out of whack, like this person's right here, that would be an issue. If they can't get down to at least 45 degrees, also an issue. If their knee is buckling inwards or way outwards, an issue. So you're looking for things like that. Now, if the client can't do a single-legged squat, which a lot of people can't do one, even though you actually don't have to go down that far. Let's say you have a 300-pound, overweight or obese client who never does anything. Yeah, probably not gonna have them do a single leg squat. Anyways, an alternative is the step down, and essentially that can be done on a 6-inch box. You really don't have to know a whole lot about what it is. Just know that it assesses movement quality in the lower limb, and it is an alternative if someone can't do a single leg squat. Again, that would be the step down on a 6-inch box. All right, so now we're moving on to the nutrition section of the study guide, and as you might expect, there is some important information in this part. All right, so let's kick this off by saying that we are personal trainers, not dietitians. We don't develop meal plans for clients. We don't do medical nutrition therapy. That being said, we can do things like help our clients to understand food labels, what certain nutrients do in the body, etc. Also, we can use the dietary guidelines developed by the government and the recommendations from myplate.gov. If there is a question about what you can legally do as a personal trainer nutrition-wise, the answer most often will have to do with the US Dietary Guidelines or myplate.gov. Also, it won't be uncommon for a question to come up where the best thing for you to do would be to refer the client to a registered dietitian. For example, if a client has diabetes and they want to lose weight, even if it's something that you could help them with, the correct thing to do would be to refer them to a dietitian. So anyways, moving right along now, there are 6 basic nutrients. We have carbohydrates, proteins, fats, vitamins, minerals, and water. Keep that in mind. These are the 6 basic nutrients. And one thing you definitely need to memorize is that 1 gram of protein is 4 calories, 1 gram of carbohydrate is 4 calories, and 1 gram of fat is 9 calories. Like I just said, make sure to memorize this piece of information. So you have micronutrients. Micronutrients would be things like vitamins, minerals, and phytonutrients, which come from plants. You have complete proteins, and these provide all the essential amino acids. Animal and dairy proteins fall into this category. You also have incomplete proteins, and these are missing 1 or more amino acids. Plant proteins fall into this category. So when it comes to improving someone's diet, oftentimes them recording their food is something really useful to make happen. So diet recall is when clients report what they've eaten in the last 24 hours. Diet history is when clients answer questions about habits, likes, dislikes, weight history, medical history, etc. And a diet record, for whatever reason NSCA likes to mention this one quite often, is a 3-day log in which the client records everything they eat, food, drinks, supplements, you name it. So just good to know the difference between these 3 things because they're similar, but each one is just a little bit different. Moving on to protein recommendations. So 0.83, sometimes it's rounded to 0.8 grams per kilogram of body weight, is what is recommended for sedentary people when it comes to protein intake. Kind of the bare minimum. If you're sedentary, you want to still be having at least this much protein. General athletes, so someone who's, running or playing a sport, maybe doing some kind of lighter weight training, they're going to want 1.4 to 2 grams per kilogram of body weight. And then if someone is focused on building muscle mass, they're going to want 1.6 to 2.2 grams per kilogram of body weight. And this 1.6 here is underlined because NSCA essentially thinks that if someone is really focused on building muscle mass, or even fairly focused on building muscle mass, they're going to want to shoot for at least this much. So good for you guys to know pretty much all of this stuff, either worth memorizing or definitely worth knowing well enough to get right on a multiple choice question. We have carbohydrate recommendations coming up next. A diet of 60 to 70% carbs is commonly recommended for physically active people. Endurance athletes are going to want 7 to 10 grams per kilogram of body weight. Strength athletes don't need quite as much because they're just not burning quite as many calories. 5 to 6 grams per kilogram for them. Just like with protein, look these things over a good handful of times. Good to know because, yeah, definitely could pop up on the big test. Fat recommendations are next. It's recommended that 20% of calories come from fats. It's more like 34% in the US and actually some other parts of the world too. So if you live in the United States, there's a decent chance you're eating too much fat. Again, a lot of other countries are in a similar situation. 20% of calories should come from fats according to the NSCA. 2/3 of the 20%, so the 20% we're talking about up here, should come from mono or polyunsaturated. We'll talk about those in a sec. And less than 10% should come from saturated fat. Also really good to know, less than 10% should come from saturated fat. 2/3 of the 20% should come from mono or polyunsaturated fats. Good to know all of this stuff, memorize it, or just look it over a few times so you get it right on the test. So we got a whole bunch of different types of fats here. We have monounsaturated fats. These are heart healthy. Some examples are olive oil, avocado, peanuts. You also have polyunsaturated fats or omega-3s. These are also heart healthy, and you can get those from fish, flax seeds, and some dairy will actually have some as well. There's also polyunsaturated fats, and those are omega-6s, and these are essential for growth and development, vegetable oil, nuts, and seeds. You also have saturated fats, and these are always a little bit controversial. Health benefits are unclear. You do want to limit consumption. Animal fat, full fat dairy, and coconut would be examples here. Trans fats are no good. Typically they're artificial or created in like a lab or something along those lines. Yeah, they're bad, so just keep that in mind too. There is 3,500 calories in a pound of fat, and a 500 calorie deficit would get you roughly a pound of fat loss every week. Some good quick information on this slide here, and some of this could definitely appear in your final test. So some fat soluble vitamins, you have A, D, E, and K. These vitamins are stored in fat in your body, which means you can actually overdose on these vitamins here. So A, D, E, and K. Keep that in mind. There's also water-soluble vitamins, and these ones are not stored in fat cells in the body, so you tend to just pee out any excess of these guys, and that would be vitamin C and the B vitamins. So the major minerals are calcium, phosphorus, magnesium, sodium, potassium, chloride, and sulfur. Probably don't need to memorize that one. These other two are pretty important though. You have monosaccharides. These guys are simple and can't be broken down. Glucose, fructose, and galactose would be examples there. Probably not worth memorizing, but good for me to tell you either way. Could pop up on the test. Same goes for disaccharides, and these are two monosaccharides joined together. Sucrose, maltose, and lactose would be examples there. Then you have polysaccharides, and these are long chains of glucose units. Glycogen, fiber, and starch are examples there. Moving on to hydration, this one's always pretty big on the test as well. Before exercise, your client should be having 5 to 7 milliliters per kilogram of body weight of water, and that's 4+ hours before the exercise event. And then essentially you'd want them having 3 to 5 milliliters per kilogram 2 hours prior. So there's two things to keep in mind here: 4 hours or 4+ hours prior, 5 to 7 milliliters, and then 2 hours prior, 3 to 5 milliliters per kilogram. I would memorize the 5 to 7 one. This one over here, probably good to know as well, but I think the 3 to 5 is less likely to pop up on the test. Look both of them over. During exercise, replace sweat lost due to exercise. So they want you to weigh your person before And after exercise, I know that's pretty intense, but that's what they want. So replace sweat lost due to exercise, and you're going to want to replace sodium to avoid hyponatremia, which is essentially when your body just doesn't have enough sodium. Potassium, magnesium too. Sodium, potassium, magnesium, those are the 3 electrolytes. Sodium is the most important to replace. That's the one that's going to really get you the most. If activity lasts over 60 to 90 minutes, a 6 to 8% carb solution is advised. All super good stuff to know. After exercise, clients should drink 20 to 24 ounces for every pound of sweat lost, so 600 to 700 milliliters. Sodium-rich foods are also encouraged. So some dehydration signs: dark, strong-smelling urine, decreased urination, essentially they just don't have to pee as often or they're peeing less, rapid heart rate, prolonged muscle soreness. There are other signs too, but these are some important ones to know. Make sure you look all of this over a few times. Listen to me say it a few times. So now we're moving on to the last section of this guide, and that is random stuff worth knowing. Let's get into it. Anyways, the nervous system has 2 main components, the somatic nervous system and the autonomous nervous system. The somatic nervous system is mostly under our control. It mostly involves skeletal muscle and things like that. The autonomous nervous system is automatic, as the name would imply, meaning it's not under our control. Anyways, the autonomous nervous system is split into 2 parts. The sympathetic nervous system, which controls our fight and flight response, and the parasympathetic nervous system, which has to do with resting and digesting. Type 1 muscle fibers are slow twitch, meaning they have better endurance but produce less power. Type 2 muscle fibers are fast twitch. They generate more power but have less endurance capabilities. It is supposed to say endurance, not deterrence right there. So again, type 2 muscle fibers are fast twitch. They have more power, strength capabilities. They're more explosive, but they fatigue faster. In type 1 muscle fibers, those are better for endurance, but they don't produce quite as much explosive force. When we're talking about scope of practice, the least aggressive answer will usually be the correct one. Example, you have an injured tennis player client. What should you do? Answer, you're going to show the client some stretches. You're not going to take him through a full-on bout of physical therapy rehab. You're just going to show him a few stretches that might help him out and leave it at that. Maybe refer out if needed. A few different types of stretching here. You have static stretching, and this is usually holding a stretch for roughly 30 seconds. And again, this is like the typical old school, just kind of chilling here, holding a stretch. Then you have dynamic stretching, and these are movement patterns designed to mimic the workout. Take, for example, doing a bunch of toe touches. So reaching up tall overhead, moving down towards my toes, coming right back up, doing those a handful of times before doing some deadlifts. Leg swings, arm circles. There's a million different examples here. Even bodyweight squats would count. Ballistic stretching is always the controversial one, and these are kind of bouncy and swinging around, and yeah, typically these ones are no good. So yeah, avoid ballistic stretches. They're kind of crazy. If something questionable comes up in a session, like your client sharing too much information about their divorce, the correct thing to do would be to redirect the focus of the conversation back to the workout. Good to keep that one in mind. This is always a really good one to know, and you really never know when you're going to need it. So remember breakfast, lunch, and dinner. You have 7 cervical vertebrae, and you can see those guys right here. So think 7 a.m. for these first 7 vertebrae. Again, these cervical ones right up top. Next we have lunch, and of course lunch is at 12 o'clock. So we have 12 thoracic vertebrae. Again, these are the middle dudes right here. Then what time are you going to eat dinner? Of course, 5 o'clock. Duh. So we have 5 lumbar vertebrae right here at the bottom part of your spine. You also have 5 fused sacral vertebrae. That part's not quite as important to know, but hey, you can see those guys right down here. So if you couldn't tell, next up we're going to be talking about kids or adolescents and some recommendations for them. So there is no minimum age for kids to begin resistance training as long as they have the emotional maturity to follow directions. Oftentimes 7 to 8-year-olds is where, traditional weight training is going to start to make sense. But again, there is no official age. Kids could start younger than that. And 5 to 6 years old for more functional drill type moves. Think about like running between cones, doing a plank, which is kind of like a simple drill type move, sit-ups, push-ups, stuff like that. Use light to moderate weight, so less than or equal to 60% estimated 1 rep max for kids. Start with 1 to 2 sets, 8 to 12 reps with a variety of moves, so you're not focusing on any area of the body in particular, you're kind of just hitting a little bit of everything. Kids should resistance train 2 to 3 non-consecutive days weekly, so maybe like a Monday, Wednesday, Friday kind of a deal, or a Monday, Friday, or a Monday, Wednesday, not back-to-back days. Typical warm-up and cool-downs, so dynamic warm-ups in the beginning, 5 to 10 minutes typically. Cool-downs could include a little bit more static stretching. Pretty typical stuff for the kids. So in a sole proprietorship, a business is owned by an individual and there is no protection for the owner. An LLC, however, does provide protection and forms are required, but they are relatively simple compared to something like an S Corp. S Corp stands for small corporation. So an independent contractor is a self-employed person or entity contracted to perform work for or provide services to another entity as a non-employee. As a result, independent contractors must pay their own Social Security and Medicare taxes. A worker is an employee when the business has the right to direct and control the work performed by the worker. This includes hours worked, uniforms, etc. And if you're a typical employee in a gym or anywhere else, you're going to be a worker or an employee. Making a big old pivot over here to stroke volume, and stroke volume is the volume pumped out of the left ventricle of the heart. Cardiac output is another good thing to know, so heart rate times stroke volume equals cardiac output. And again, you never know if something like this is going to pop up on the test. I wouldn't be surprised if it did. So you have 3 parts of a plyometric exercise, and a plyometric exercise is like a jumping exercise. Anyways, part 1 is the eccentric phase, and you can see this guy, he's kind of lowering down into that squat. And essentially muscles are lengthening as he's going down there. Part 2 is the amortization phase, and this is the transition phase, or the delay between eccentric and the concentric phase. As you can see, he's almost ready to explode upwards. So it's that short but noticeable pause at the bottom. And then the third part is the concentric phase, and that is the shortening phase. Essentially, it's when the energy is released, and here I have an example of someone finally lifting off for the jump. The said principle is always a good one to know. The body will adapt to the specific demands placed on it. As far as the said principle goes, again, the body will adapt to specific demands placed on it. So if I'm doing a ton of bicep curls, my biceps are going to get really big and strong if I'm consistent and consuming protein, yada, yada, yada. Here's another thing that a lot of these organizations love. They love overtraining, which is an excessive frequency, volume, or intensity of training resulting in reduction of performance. This is also caused by a lack of proper rest and recovery. This is incredibly rare in our world as personal trainers, but hey, it's possible, it can happen. Even more extreme than that is rhabdomyolysis, also known as rhabdo, and that's the rapid breakdown of muscle resulting in high amounts of intramuscular proteins, and it can be dangerous to the kidneys. If someone works out way too hard for way too long, rhabdo is possible. Again, it is actually very rare. So you have 3 different types of levers, class 1, class 2, and class 3. None of this is worth memorizing, but hey, I'm going to say it anyways because you could get a question. For a class 1 lever, the fulcrum is in the middle, the effort and the load are on opposite sides. There are some examples over here. Again, not worth memorizing. In a class 2 lever, the fulcrum is all the way to one side, and then the load is in the middle, and the effort is on the opposite side. In a class 3 lever, the fulcrum is also all the way to one side, but the effort this time is in the middle, and the load is all the way to the opposite side. And again, there are some examples on this page, not really worth memorizing, probably worth looking over. So it's somewhat common to be asked about 2 different types of blood pressure meds. You have beta blockers and diuretics. Beta blockers lower your heart rate at rest and during exercise. A client's heart rate won't raise the same way during exercise when they're on a beta blocker, and again, that's actually why it's good for you to know about them. So diuretics increase the excretion of water from the body through the kidneys, and this could increase the likelihood of dehydration, and of course that is relevant to us. So there's 2 different types of diabetes. You have type 1 and type 2. In type 1, these people have to inject insulin, they are insulin dependent, and people usually develop this very early into life. Adolescence, teenage years, maybe early 20s, that's typically when someone's gonna know if they have type 1 diabetes. Then you have type 2 diabetes, and these people are insulin resistant. This one usually comes from poor lifestyle choices, and because of that, it's far more common. So if someone is eating way too much food, became overweight, they're not really working out all that much. Again, type 2 diabetes is typically the one that we're looking at. You never know if one of these guys is going to pop up on the test, so good to go over them now. You have dyspnea, and that is difficult or labored breathing. You have syncope, which is fainting. Then you have orthopnea, I think I'm saying that right, and that is the sensation of breathlessness in the recumbent, essentially laying down position, relieved by sitting or standing. Falling is the #1 claim made against fitness facilities and professionals. Another good one to know. Falling is no good. So when it comes to exercises, there are open kinetic chain exercises and closed kinetic chain exercises. For open kinetic chain exercises, the distal part of the body moves. So some examples would be curls, leg extensions, or bench press. If we're looking at the leg extension, the distal part of the body or the knee and ankle are moving. In a closed kinetic chain exercise, the distal part of the body is stationary. So if I'm squatting, for example, my feet are planted to the ground. Same thing is true for a push-up or a hip bridge. So glycogen is the stored form of glucose that's made up of connected glucose molecules. This is the one that is stored inside of your body and broken down and turned into ATP. Gluconeogenesis is the process of how glucose is created within the body. Protein can be used in this process. So DOM stands for delayed onset muscle soreness. Usually this begins to develop 12 to 24 hours after exercise and is most intense 24 to 72 hours later. And while we're talking about that, the eccentric portion of the lift where the prime mover or agonist is stretching, again, think the bench press, where I'm lowering the bar and my pec major is stretching out. This is the part of the lift that causes the most soreness, so just keep that in mind. So to calculate someone's max heart rate, you simply do 220 minus their age. So if you have a 20-year-old person, it would be 220 minus 20, and their max heart rate would be around 200. Know that the heart rate reserve formula is the Karvonen formula. Don't really need to go into any more detail on that. Stroke volume is the amount of blood pumped out of the heart's left ventricle with each beat, and then cardiac output is heart rate times stroke volume. So osteoporosis is a bone disease that causes bones to become weak and brittle, increasing the risk of fractures. Osteopenia is a decrease in bone mineral density that's not severe enough to meet the diagnostic criteria for osteoporosis, but it's getting there and it is a concern, so just keep all of that in mind. Exercises on the floor where you're laying on your back or supine are contraindicated for pregnant people after the first trimester and for people with hypertension or high blood pressure. And since we have a person doing a bridge down here, a common mistake that people make while bridging is raising their hips too high, which can cause hyperextension in the lower back. Keep all of that in mind. I've seen questions asked about that in particular. So guys, keep in mind, this video is only one part of the puzzle that is studying for your NSCA CPT exam. You shouldn't only be using this video to pass the big test. You should, at the very least, skim through the textbook, link in the video description down below for that. Also, I'd highly recommend using the Pocket Prep app for review, as it's the cheapest and most efficient way to practice NSCA CPT trivia questions. You should maybe think about buying one of these two practice exams. Both are worth considering, and obviously I'm biased, but I think ours is a far greater value than NSCA's at this price. Also, make sure to watch each of these 3 basic anatomy videos once or twice leading up to your test. Don't bother memorizing everything in these videos, but knowing basic bone and muscle anatomy is pretty big for this test. Watch this part 1 and the upcoming part 2 video, which should be out in a week or two, a few times each. Make sure you understand everything that I go over in these 2 videos at least fairly well. Good luck to all of you, not that you're actually gonna need it. Study hard, do an hour or 2 of work most days of the week, and within 2 to 6 months, you should be good to go. I know that 2 to 6 months is a decent amount of time, but in the grand scheme of your entire life, that's not that crazy of a commitment. This is the start of your new career. If any of you have any questions or comments about anything that we went over today, or just passing your test in general, make sure to leave those down below. I will respond to you. If you appreciate the hard work and tons of hours that went into making this video and guide, please don't forget to like the video and subscribe to the channel if you haven't done so already. That support really does help us out, and it allows me to keep making free trainer education content for all of you. Thanks for watching, everyone, and until next time, stay sorta healthy.